Welcome back to the hourinvite podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Fortier, the Chief Pharmacy Officer at Massachusetts General Hospital. Thank you so much for joining us.
Great. Happy to have you, or happy to be here with both of you today. Thanks for the opportunity.
Thanks for virtually meeting with us and taking the time out. Just want to get into a little bit about your role. Can you explain to the viewers a little bit about your role as the Chief Pharmacy Officer at Massachusetts General Hospital?
Sure. Thanks. Again for the opportunity. So I've been at Mass General now for about 6.5 years as a Chief Pharmacy Officer. Mass General is a 1,000-bed academic medical center here in the middle of Boston, treating obviously every disease state that there is out there in terms of being a general hospital. My responsibilities involve everything from both inpatient, outpatient, pharmacy services across the institution, and off campus. We do have a variety of satellite locations as well. So responsible for, of course, our clinical programs, our regulatory, our finances, everything that goes into running a pharmacy department. I'm responsible for. We have an outstanding team here, an outstanding team of leaders, outstanding team of pharmacists and technicians. And obviously work very closely with our physician and nursing colleagues across the institution to continue to elevate practice.
So Massachusetts General is known around the country and the world as a very well-establishment, is a very elite establishment. What really separates you guys from the other ones, and what makes you guys hold that prestigious title?
Yeah, I think that's a great question. We've been around since 1811, so I think we're the third oldest hospital in the United States. And so when you're around that long and you innovate, literally for over 200 years, you get a pretty strong reputation, and people, the best and brightest want to work here and to be part of it. I think, from a quality perspective, it really comes down to sort of the basic mission and vision, right? We want to be one serving every patient that comes in here, no matter of their ability to pay or to not be able to pay. And we invest a lot in terms of our quality, whether it be in projects, in resources, both financially and in labor, in terms of having staff. It's a very big cornerstone of the institution. And it's just always kind of in the back of your mind. So you're always working on how can we enhance quality. We have a structure to support it. And then ultimately, how are we innovating and learning from that? I think that's really where we sort of get our reputation. But, we've been doing it for a long time. And so able to sort of have worked through a lot of the kinks and know what works and continue to change as healthcare changes.
So you've been around for a long time, as you said. So how important is it to establish a culture in what you're doing?
Yeah, so I haven't been around for a long time, but the hospital has been for a long time. So the culture is an interesting piece, right? So again, I think it's very much embedded just in 200 years of, again, how are we servicing every patient that comes through our door, and ultimately, how are we innovating? And so you're pushed to be strategic and be thinking, to be thinking as forward as you can. Fortunately, our institution does fairly well financially, and so we are able to have the resources, whether it be staff or to do other things that are major. We're a major research institution, and so we're on the cutting edge of, in terms of medications, a lot of therapies that we may not see for many years to be commercially available. We're seeing those already in clinical trials, and it gives us the ability as a pharmacy team to start thinking about, okay, when we start really using these widespread, how are we going to handle them clinically? How are we going to prepare them in our IV rooms? And so that's really kind of where the culture has come from. But it's, like I said, it's been, sort of what the original culture is of the institution when you sort of walk through the doors here.
As your role as a Chief Pharmacy Officer, what has that role taught you?
Yeah, so my role, I guess a couple things. Pharmacy has continued to evolve over the years. We're still not where I think the profession wants to be, and I would say it's extremely multidimensional, and it only gets more and more complicated every day. We unfortunately, I don't think that we can say, well, today we're just going to do this, right? And we're going to try to get that done. There's so many things that come in your way. So in my role as a chief pharmacy officer, I'm going from meeting to meeting to meeting today, where the first meeting might be about a clinical topic. The second meeting might be about regulatory. The third meeting is talking with you guys and sort of mentoring and coaching and supporting students. The fourth meeting is about renovations. The fifth meeting is about, something completely different. And so you have to know you have to know a little about a lot of things to be successful and continue to move forward. So I think it's very multidimensional. It makes it exciting. It definitely puts us at the forefront of a lot of care, but we need to be at the table, in general. But yeah, I would think is just, you got to sort of stay on top of everything and know enough about all of these topics to really be successful. So
you mentioned how you have to stay on top of it, and you have so many meetings back to back to back to back. How do you keep motivated to wake up in the morning and be able to push through these, busy scheduled days?
Yeah, I mean, I think, for me, thinking back, I've been in this job for about 6.5 years. I came into this role pretty early in my career. I was about, I was about 8 years out of residency when I got this job, and this was my dream job. And this wasn't a job that I shouldn't have got. Probably shouldn't have got right at that early part of my career. I was brought into an institution, obviously, that you guys know, that's very well recognized, has a lot of tradition, and we needed to turn around the pharmacy department. And so I thrive on sort of turning that around. I think we've achieved that. There's still more to do. But again, to my earlier point, it's just doing different things every day and impacting sort of the lives of patients, supporting our staff, doing innovative type projects and things with either internally, with other disciplines, with vendors in the market, just really kind of gets exciting.
So you alluded to that you don't think pharmacy is exactly where you want it to be. So why don't you think pharmacists are obtaining provider status, in your opinion?
Yeah, I think it's a good question. So fortunately, we've had some professional organizations that have taken this on as something that we want to push for, and I completely agree. I think it will make things hopefully a lot easier, and obviously we'll be able to do a better job in billing for our services. I really think that we need to do a better job as a profession to really kind of come together more on this common topic. So I'll give you an example. Nursing has been a really good sort of case study, in fact, of bringing people, all the nursing groups together. And so what were they able to do? They were able to become, CRNAs. They were able to become nurse practitioners, right? Advanced practice roles, because they had one voice and said, we want to do this. We want to elevate care. We still have, as much as I think we've seen over the last couple of years, pharmacy associations have come together, the different ones, APHA, SHPA, MCP, right? All these different groups. We've seen them come together more, but we need them to come together for really a common purpose like this. And I think everybody just had different priorities, where nurses says, this is what we wanted to do, and this is what we're going to go for. So they were able to change federal government. They were able to change state governments. They were able to all be on the same page, pushing in one direction. So I think that's where we sort of are missing the boat. And hopefully we can kind of keep this sort of as a big priority to really move things forward. And how can we use situations like COVID to say, look, hey, here's a great example where you didn't have the physicians you need or the nurses that you needed. How can pharmacy play a role? And how, if we had provider status, could we have elevated practice or taking care of those patients? So never let a crisis sort of go to, use that crisis as best as you can. And so we'll see what will happen with that, and will we push forward and take advantage of that.
In the past couple of questions, you mentioned the word innovation a lot. Is that something you guys really stand by at Massachusetts General? Is that something that you guys are always trying to stay on top of?
Yeah, I mean, I think, of course, you have to always make sure you have the bread and butter working well. But, for me personally, it's really about how are we thinking ahead? How are we being strategic? How are we getting ahead proactively in terms of the changes in healthcare and the changes in pharmacy? There's obviously tweaks to things here and there that are just the bread and butter that you need to do. But, how do we get pharmacists out of the basement, out of the inpatient pharmacy? And how do we have technicians and automation running the show and have our pharmacists up in direct patient care. Well, that's not going to happen, you know, in over 1 year or 2 years. You have to have a vision and setting the groundwork of what that goes. And so again, how do you innovate? How do you partner again with vendors? How do you work with your colleagues across the country to do that? It's really important. So to me, it's a balance, right? You need to make sure the ship's running well, but then you also sort of have to be thinking outside the box of what are the other things that you need to do as an organization to support either the organization or the pharmacy profession, you know, moving forward.
Where do you think the profession's headed?
Well, that's a big question.
We'll say like within the next 5
yeah,
years, nothing.
Yeah, I think it's a good question. I think, you know, obviously in the public eye, there are two really big things that pharmacy, you know, people are hearing about. One is drug shortages. Two is expensive drugs. And so, you know, what is our role in sort of addressing both of those things in terms of the public health as well as helping to manage very high cost drugs? When I was in pharmacy school, I think back, I graduated in 2003, you know, like a drug like Lovenox, which was about $1,000, was like really expensive. Like, oh my God, how are they going to afford that? Now we're talking about drugs that are over $2 million. And so how is that sustainable when inflation's still increasing at 2%? Your reimbursement for drugs is going down. So, you know, I think those are the two things in the public eye that we need to definitely be involved with and play a role, and where do pharmacists play in just managing drug costs overall. Of course, I could sit here and spend the rest of the time and say, here's 50 other things of where we're going. But I think those are two sort of important things that we could play a major role in, working with our professional organizations, helping the greater good of patients, and managing, you know, sort of the finances of the institution, as well as drug shortages, which become really difficult. And so we're actually partnering with some vendors around drug shortages in terms of how we can, what I'll call, do continuous manufacturing and not have to be reliant on API from other countries. Again, there's still more to be proven to do that, but we're in those discussions and trying to work with people to make those types of things happen.
So to alleviate those issues, how important do you think it is to be able to communicate with other organizations outside of pharmacy, AMA, optometry, things like that? How important are those connections to get the legislation we need passed to make those things happen?
Yeah, I mean, I think those relationships are really important, and I think that you've seen a lot of professional associations, pharmacy and other healthcare sectors really come together more. Drug shortages have been a great example of that, where we worked with the AMA and we've worked with the anesthesia, you know, societies to bring those things together. Of course, right, if you're trying to get provider status and you have other providers saying, hey, there's an opportunity here. Pharmacists have, this is their specialty. This is what they can do. They can help alleviate a lot of things. Physicians, nurses can go focus on other stuff. That's huge. I wouldn't say that has necessarily happened fully yet, but that's really where we need that collaboration. I think you're seeing that with professional organizations, but we need to do more of that. Again, it's tough, right? They have their issues and their priorities that they're trying to support their members. How can we show them that we can help address a lot of those, their staffing issues? You know, a prime one right now, we talk about pharmacist burnout, but what about physician burnout and physician workload, right? Are there things that we could take off physicians' plates that we can do and better manage patients in general and provide better quality and safety? That is a no-brainer. So, you know, those are the types of things I think we need to be thinking more about.
So for the audience watching, obviously there's different types of fields in pharmacy that you can go into: retail, hospital, managed care, anything. There's many things. So let's just bring forward the two most common ones: retail and hospital. What do you think separates the retail pharmacist from a hospital pharmacist? Is there something that makes you more qualified to be a retail pharmacist than a hospital pharmacist?
Yeah, that's a good question. I mean, you know, I think in the end, you know, when you all will graduate and you raise your hand and you take the oath of a pharmacist, right? We all sort of are committing to the same thing in terms of taking care of patients and doing things with integrity and you know, and ensuring the sort of health of the public. You know, my life has very much been in hospital pharmacy. you know, obviously I have some oversight of our retail operations. I wouldn't say, you know, there's certain traits that make somebody better in one than the other. I think it's just kind of where your interests are, where maybe you've exposed to mentors that drive you into or recommend things into going into one area or the other. You know, I think the profession now, and I'm not sure if this is where you're going with your question, but you know, when I was coming out of pharmacy school, they were building community pharmacies on every corner, literally across from each other. That has not happened. And I think we're even starting to see even decreased payment of pharmacists' salaries because, you know, there are not as many positions, same in the hospital, same in retail. And so I think students and even those just, you know, any pharmacist need to be thinking about, you know, how do you make yourself as well-rounded as possible coming out of pharmacy school, in residency, in your job, whatever it may be, so that you can sort of be able to kind of take on different roles as sort of healthcare changes, right? A lot of things have become centralized. They're going to become more virtual. Here's a prime example of that. And so maybe we're going to be practicing in a lot different environment. And then how do you have the skills and the background and the experiences to compete for a position that is sort of, you know, a little bit more on the forefront and in terms of the kind of the changing society and the changing times. So I think that's going to be important. But to answer the original question, I wouldn't say I could say, well, this trait says you're better here and this trait says you're better there. I think it's just where your interests lie and where you want to go into. I very much believe in, even if you're going to community pharmacy, you should do a community pharmacy residency. You should continue to develop your skills more than just kind of, you know, we don't want to see people going through the motions. How can we elevate the practice both in the hospital as well as in retail for our patients?
So to get back to that, what made you want to go into pharmacy? And especially, was it something you grew up? I know I didn't grow up thinking, man, I really wanted to be a pharmacist, got to be honest. So what made you want to do that?
Yeah, so I always like to tell this story. I was initially interested in being an undertaker. I had a family friend who drove a really nice car and had a nice house, and he ran a funeral home. And I'm like, well, you know, everybody dies, so you have a pretty good built-in clientele. But then I really liked, you know, I was looking at physical therapy, but probably many of you or people listening, I had a mentor, a family friend who was a pharmacist who said, hey, you should really look into this. And I actually was set up with my guidance counselor to go to go with a clinical pharmacist, which at the small community hospital where I grew up wasn't really, I would say, a common thing. And I still remember him taking me into the psych unit, and I was like, wow, this is awesome. And he was like showing me what he did and how he was helping these patients who were literally, you know, bipolar and suicidal and had schizophrenia, and how medications could help manage them and all of that stuff. So I was like, you know, I kind of want to look into this. And so that's really kind of where the initial interest came. I never thought I would be where I was today. I never thought I would have lived, you know, I lived in South Carolina for 10 years. You know, now in this position, I would have never guessed that. Obviously day one, I didn't know I wanted to be in this role, but I think, again, you get different experiences, you put yourself out there, you network with people, you get mentors, and sort of you go down different paths. And so I think people really need to be open to that. Yes, grades are important, but it's not about just putting your head in a book all day. It's really about being part of professional organizations, about networking with people. It's about, you know, just getting out there and putting yourself out there and being involved, that I think it really opens up your knowledge and opportunities to other things.
You spoke about mentorship, and in school, we all have, you know, those mentors and mentees going through school. How important do you think it is to still have that mentorship when you get to a position like yourself? Like, a lot of people, you know, get to a position like that, they're like, you know, I made it. Do you think that's important?
Yeah, I think it's a great question. Let me first say I wouldn't be here if it wasn't for my mentors. And I say mentors plural because I've had many of them at all different stages of their career, some in pharmacy, some outside of pharmacy. And, you know, I actually kind of got away from kind of talking with some of my mentors. And I was, you know, preparing for this a little bit, and I had come across an article recently that I'll just quickly share that I am sort of kind of getting back and looking at and sort of getting back on the horse regarding mentorship. But there's a gentleman named Anthony Juan, TJAN. He's a CEO of a Boston venture capital firm here in the city. And he talks about having 5 different types of mentors. Mentor number 1, the master of the craft, like who is like the Bill Belichick, who really is the expert. Mentor 2, the champion of your cause, like who is there, who's got your back, who advocates for you. Number 3, the co-pilot, like who is sort of a colleague that you can sort of knows the inside, who can say that you can sort of vent to. Number 4 is the anchor. This doesn't necessarily have to be somebody within pharmacy, or it could be outside of pharmacy or outside of healthcare that, just kind of, gives you sort of your confidant, your sounding board. And then number 5 is the reverse mentor. And that really is sort of, how are you learning? Like, how am I learning from you guys today? Are there things that, I can say, hey, that's really interesting. I should think more about that. So I cannot underestimate the importance of a mentor. Even if you don't know where to start, I think you can is there somebody that you sort of connected with that you may like to talk more about? There's no reason why you can't say to them, hey, do you think we could spend some time and just kind of talk about my career goals or some questions that I have, whether it be a faculty member or just somebody, a preceptor, whatever it may be. But you as the mentee have to work at that. Like, you have to set up times, you have to keep that moving, right? I'm a very busy guy. I would love to mentor people all day long, but unless somebody's coming to me and saying, hey, could we set up another time? I'm happy to do it, but you got to sort of move those things forward. So I think mentorship is probably the number 1 most important thing. And I see too many students going through pharmacy school without a mentor, or even, in residency or their first job, that I think really could set them up for more success, as they go through their careers.
Awesome. So how has the current pandemic affected the way the pharmacy is operated there at Massachusetts General Hospital?
Yeah, so I would say it's not just here at Mass General. It's, it's hospitals across the country. I think, as we went through the COVID surge, and I will say we had about 400 patients here at the hospital that had COVID. About half of those were in the ICU, which is significant. We usually have about a little over 100 ICU beds, and we had 300 patients in the ICU, or 200 patients in the ICU. And we had the most COVID patients of anybody in the state here at our institution. So I think we learned a lot about sort of what, we were able to step up to the challenge in terms of supporting these very sick patients, supporting our employees, all of that. If you want to think about how COVID will change, and I'm actually collaborating on an article right now with a couple other leaders. Basically, we've chosen some leaders from different parts of the country to sort of say, like, what is this going to look like in a year? I think obviously the financial component for hospitals is going to be a tough one. And so where does pharmacy play in terms of working to create a lot of revenue? We are a revenue generating resource here at the hospital for the hospital. And so are there other opportunities that we can get to help the bottom line of the institution? I think the other piece is just the staff and staffing, right? How does that look? So how do we want to ensure our staff are safe? How are we sort of cross-training our staff to take on surges, right? We had 200 ICU patients. We're used to taking care of 100. We had to train other people who didn't work in an ICU to work in an ICU. And so how are we cross-training people? What is work from home going to look like? Are we going to continue with that? How are we going to continue to oversee our staff that are doing that? And then there's hospitals that are going to be dealing with staff in terms of having to cut positions. We've already seen some people take pay cuts, some people take furloughs, and how quickly will that sort of be able to get back? But I would say the third piece, so I think it's financial. I think it's sort of the staff and staffing and what that looks like. I think the third piece is just, as I alluded to a little bit earlier, where is there an opportunity here, right? A lot of the federal laws and CMS, and they change things to allow pharmacists to, even to order tests, to do testing, right? Where is there an opportunity for us where we didn't have we're able to get our foot in the door? How can we get our foot in the door and stay there in terms of our practice? And so how does our scope change? What does that look like? And how can we play a role not only in the inpatient side, but in the outpatient side? maybe differently than we did before in terms of telehealth, which maybe we weren't doing much of those. When you guys go on rotation in a couple years, will you be doing rounds via Zoom? What's that going to look like? You know, so I think those are the types of things that we're, you know, thinking about. And in terms of just the financial situation, what do you have to stop doing because you may not have the resources? What would you restart doing? What do you prioritize? I think that's really what people need to be thinking about in terms of pharmacy right now as we move over the next, you know, couple months.
So with COVID-19, when it happened, there's a lot of questions. There's something new that we didn't all expect it to happen. Lack of PPE, lack of testing, not enough testing, not enough ICU beds. Do you think the country or Mass General and also other health systems are ready for a second wave?
Well, yeah, I mean, I think we know what we just went through, right? And I think it behooves institutions and pharmacy departments to debrief with their teams and sort of say, you know, what would we have done differently if we had, you know, known what sort of the outcome of this was? You know, we're thinking about how are we going to be, you know, having, I don't like to use stockpile, but how are we going to make sure we have the medications we need? How are institutions, I was just talking with the head of materials management about, you know, them sort of making sure we have, you know, many months of PPE and gowns and those types of things. And so, you know, how are we doing that? So continue to cross train our staff, making sure we have enough drug supply and having maybe ordering some more to have on hand if we do go through another surge. I just don't think, I think we kind of went through the sort of the worst. I think we kind of know what to expect. It's just now putting yourself and strategizing on making that happen within people's, you know, different organizations.
So what advice would you give to new pharmacists to make sure they practice at the top of their license? Like they just graduated, you know, passed their boards. What would you say, you know, like you need to do this so that you can prepare yourself or better be in a position to move forward?
Yeah, I think there's a couple things. You know, as I said earlier, I think ensuring people when they're in school and outside of school, and even for me still today, is continue to be as well-rounded as possible. I use sort of the, you know, the anecdote of, you know, you have a tool belt, right? And if you're going to go out and do construction, right, you can't just have a hammer. You need the other pieces, you know, the other tools in your tool belt. So how are you sort of not niching yourself, and how are you sort of gaining all of those different experiences? I think that's number one, right? Because if you don't have the experience to go into a job, to work at the top of your license, how can you do that? And then I think the question is, you know, I still think there's opportunities for us to work at the top of their license. Even at a place like Mass General, we have pockets of really advanced care, and we have other areas that we need to get it to that level. I think, you know, when looking for positions or residency programs or whatever it may be, you just got to look at what the best opportunity is that's going to set you up for the future, right? You don't want to take something that you're going to take 10 steps back on. If you really want to do something else, like go for it, and look for that best opportunity. You know, I do think the market is going to get tight. I think we've already seen that. But I think it's going to open up a lot of opportunities other than just working in retail pharmacy and hospital pharmacy. I still believe no matter if you go into private industry or managed care that you should still do a residency, because how do you know what goes on in the retail pharmacy or in the hospital if you haven't done that, right? I see many students go into, for instance, MSL jobs out of PharmD school, and I'm like, but you don't even know how we use this drug. Yeah, great. Exactly. You want to use that. You want to go look at the literature and think that's going to tell you what to do. Well, yeah, of course we want to be evidence-based, but a lot of times we can't be. And so how do you develop relationships with the physicians? How do you talk to them? How do you work with nursing? How do you know not just the medication piece, what else goes on? That's the stuff you need to know. So I continue to push for that. And I know there's not enough residencies for the number of people that want to do them, but you have to prepare in school very early to start, you know, being competitive for those programs.
What do you enjoy most about your career?
Whew, good question. You guys asked some tough questions. You know, I mean, again, I think for me, it is about, it's about an opportunity to be at a great organization that's very well recognized, to be able to do things that I may not get to do at other organizations, to really be innovative and strategic and have relationships with outside entities to do some really cool things. Fortunately, here in Boston, you know, we have MIT and Harvard, really right across the river from us. And so we have some collaborations with those groups on different things, healthcare related or pharmacy specific. Those are just cool things that, you don't normally, get to do. Yes, those are big names, but just the stuff that we're doing is really unique, and not really many other people are thinking about that. So I think those opportunities are great. I think obviously, the staff here is, we worked very much to recruit an outstanding team. And I think, that we're really elevating practice and getting to working at the top of our license. And then, I would just say, it's about patient care. I mean, the stuff that we do here and we're contributing on is exciting. The fact that we had more COVID patients than anybody in the state and we're able to treat that like that, that's what I come into work every day to see. It's very easy for me when I walk into the main door of the hospital every day just to kind of walk to my office. And you sort of get away from sort of patient care. But about once or twice a week, I actually walk up to the floors before I go into my office because I want to remember why I'm here. I'm here about treating patients. And sometimes that gets lost in sort of, a financial statement or a renovation. You got to remember why you're here and why you're doing that and how you can support your staff and making sure we provide, ultimate patient care.
You mentioned MIT and Harvard. You're obviously surrounded by very prestigious names that are known around the world, and you guys are at the top and as a health system. Is there pressure when you go to work to there's competition, but there's not. Is there pressure to stay on top?
Yeah, I mean, yes. I mean, you always like the accolades, right? But you don't come to work every day to be, top in U.S. News and World Report and Newsweek top hospitals. I mean, that's great. And you have a lot of sense of pride when you do that. But again, I think it's just being part of a culture, going back to some of the earlier questions, of a team that wants to push the envelope, that wants to push the limits, that wants to be innovative, that's trying new things, that believes very much in high level of safety and high level of quality and in treating, equity and inclusion disparities. Maybe that you would even say, why is a healthcare organization wanting to take that on? Well, it's important for us in terms of sort of the social justice component. So I just think it's just part of the culture here that we want to strive to be the best. Me personally, I have high expectations and I'm, pushing our team all the time. I probably drive them all nuts, but that's important. We want to continue to push the envelope and not remain, I hate status quo. And so how do we sort of just not go through the motions and continuing to always perform to improve?
So how important do you think it is for pharmacists to work and participate in a national organization such as ASHP, as well as their state and local organizations?
Yeah. I think it's critical. I probably one of my biggest disappointments that I see, and you guys probably live this right now. You're very involved as a student. There's a lot of opportunities. People do it because it's kind of the cool thing to do, right? I want to be in it. You're doing it to build your resume, which is important as well. But then you get into residency or you get into a job and a lot of that completely stops. And I understand residencies are busy, but you can still be involved. You don't have to do a ton of work. And then of course people think, well, I want to be an officer on this committee. There's no opportunities for me. I'm fresh out of residency, or I'm just starting residency, or I'm just finishing school and I'm in another job. There's probably more opportunities now than ever before for new practitioners and residents and students on these national and state groups. But you have to stay engaged, right? I mean, it's like, again, it's now, it's right. You're on campus, you have a meeting at the end of the day on school, right? It's easy. You're going to have to put some work into it, but the benefits just outweigh the effort. And don't be intimidated, right? Put your name in for something. You may not get it the first time, you may get it the second time. But that's where I've sort of created my professional network, is being part of professional organizations. And ASHP is great, but there's other groups too that you should very much consider if there's areas of interest. But I think it's critically, I mean, it is, if you look at you throw mentoring in there and you throw professional organizations, those are two major things that I think people need to continue through their career. And it's ultimately a little bit, in my opinion, your duty to stay involved and to give back. And as you guys have been trying to do through this Our Invite, is keep people abreast of what's going on in healthcare and how it's changing and what are the hot topics and how to educate people. That's so important. If you just do your annual CEs, right, that's not the stuff that's really going to give you the sense of where things are moving toward.
You mentioned networking and mentorship. To me, I love to hear examples, and I'm sure the student audience would love to hear it to get motivated. Is there an example you could think back of in your career where a network or a mentor or a situation helped, because of that network, it helped your career, it helped you get to that next step, it helped you get a job, or it helped you connect with someone else?
Yeah. I mean, I'll give you an example, even getting this job. As I said, very early in my career, I was able to move into this role, which is pretty rare to be at an organization of this size and reputation. I think my mentorship and my relationships totally helped me out. I'll give you a great example. He's now retired, but the chief pharmacy officer at Brigham and Women's Hospital, who's our sister hospital, they're within our system, was a gentleman named Bill Churchill. And I got to know Bill on being on one of a professional organization. And I was living in South Carolina, but I was from Boston. So Bill and I had a lot of common to talk about sports and all of those things. Well, when the position opened up, he said to me, you should apply. You should really consider this. And he also knew my boss. And so he called her and said, hey, you should really, this guy's an up and comer. You should really give him an opportunity. I wasn't a director of pharmacy. I wasn't a chief pharmacy officer where I was before. And so that's just one. I mean, I can't tell you. I mean, the other people that wrote me letters of reference were mentors and people that were of high stature that really helped get me there. But that was just one example of somebody that I didn't think, 10 years ago that having a relationship with him would have, made this opportunity happen. I mean, obviously I had to do my role in it as well, but so you just never know. So I think you always have to be open to opportunities. You always have to kind of put your name, your interests out there, even if things don't sort of pop up day one in a week, in a month, and in 6 months, in a year. People just need to know that there's that you have an interest, and they remember, hey, I remember Chris wanted to do this. Let me call him up and see if he wants to do this. Getting on professional, organizations, on committees and in chair roles, people writing letters of recommendation who were well recognized. I mean, that's the important types of things. It is very much who you know. Unfortunately, that plays into it. And I think that network is important. But I also have networks, kind of like going back to the mentorship, with people, colleagues in my position across the country that I can call up and say, hey, how are you doing this thing? Or what are you struggling with that? Just to kind of help you, not even for career advancement. So I can't emphasize enough the importance of that.
Yeah, I feel like as students, we always hear it's all who you know, it's networking. And because you hear it so many times that people don't really register it. So hearing an example, it kind of gives context to the words that we hear all the time that, it is true.
The biggest mistake, when you guys are applying for positions or residency coming out of pharmacy school, is when you don't have somebody that can write you a letter of reference, right? Or you're asking them, hey, I was on rotation with you for 1 month.
Exactly.
You want people that you've had a long-standing relationship with that can really say, I've known Nima for 4 years, right? And people who are the dean or the associate, those are important things that you need to be thinking about and nurturing those relationships very early in your career.
Yeah.
So I'm assuming you have given a lot of residency interviews. What is one time during interviews that somebody said something or did something that stood out and you were like, this is the person that I know that I want? Or
the total opposite. They said something, you're like,
yes,
oh, no, yeah, I have examples of what.
I'm sure you have more of those.
Yeah, I have 2 examples of what not to say, but I don't want to put those on the record because if I'm interviewing anybody, they're going to know all the secrets that I ask. But
don't worry, no one's going to see this.
Yeah, okay. No, for me, in terms of when we interview people, whether it be for residency or just in general, to me, it is really about attitude. We've had people when I was in residency that were my co-residents, people that we've had that are really on paper outstanding, top of their class, have done all these things. And while that's important, they maybe weren't sort of realistic with their capabilities, right? You come to residency to train and to get better. If you're going to come in and say, I already know everything, you're not going to get better. And so to me, it's about attitude and really asking questions about, does this person sort of fit the mission, the vision, the culture of your organization? Are they honest with themselves, right? I think that I was very successful in my residency. I wasn't the greatest student. I wasn't the best clinician. I wanted to do, I did an admin residency. My first year was really a PGY1 clinical residency. And I think I was respected by my preceptors because I said, look, I don't know. I want to get better. Here are things that I really stink at pharmacokinetics. I want you to challenge me this month.
Me too.
Pharmacokinetics, right? So, those are the things you have to be honest with yourself and be able to accept constructive criticism. So I tell my residents as they start here, I don't like drama, like no drama. I want a t-shirt that says no drama with a big circle and a line through it. Right. And so attitude is everything. Come in, work hard, do your job, be open to ideas, and you can make it happen.
Perfect. I think Aaron, something happened with his internet connection, but we'll keep going. What do you enjoy most about being a student? When you were a student, what did you enjoy most about it?
Yeah, I had to think back about that question because it's been a while. I think for me, even looking back, hindsight is obviously always 20/20, but I think it's just the relationships. I believe, whether it be with my my fellow students that I still talk to today, to my faculty members that I still have relationships with. I think those are really the things that I enjoyed most about being a student. Pharmacy school is not easy. It's really hard. A lot of information is probably one of the, if not the toughest, one of the toughest majors within college. But those are the things that I still treasure, is those relationships, many, many years later.
What are 3 life lessons you learned?
3. Wow, man, you guys ask tough questions. 3 life lessons that I learned. I don't know if I have 3. I think for me, I've been very much the poster child of being perseverant. I think that's been, like I said, I wasn't the best student. I worked really hard. It's about, you definitely, you get knocked down. And I think people just need to understand throughout their lives and throughout their careers, they're going to get up, they're going to go down, they're going to get up again. And I think it's really just about perseverance and sticking with the goal and the vision. But remember that you can't do that yourself. And so going, like I said earlier, it's about people helping you. It's about your mentors. It's about your network. It's about those people that you can kind of vent to and move forward. So I think those for me are been the big things.
So I'm sure as a chief pharmacy officer, your schedule is busy. What do you do outside of pharmacy? What do you do when you go home? What do you do to, just go and get a relief?
Let loose. For me, so, in my position, obviously, there's a lot to it. And it's really important for me to balance things. I do have a family. I have 3 young kids. So that obviously takes up a lot of my time. I enjoy sports, whether watching sports, which unfortunately not doing too much of that right now. But, playing sports, I enjoy traveling. Obviously through this opportunity, I get a lot of, or working at MGH, I get a lot of opportunities to travel, not only around the US, but around the world. So I really have enjoyed that. I'm a big foodie. I like food from all over the world. So those are the big things for me that I think that I like to do. Nothing really like crazy or interesting, but pretty basic.
Has your leadership roles in the past, 15 years changed?
You mean my leadership, style and philosophy?
Yeah, your viewpoint.
Yeah, actually it has. It's interesting you asked that. So, I ended up doing an admin residency because I enjoyed sort of being in leadership roles and management roles. And when I really kind of thought about what I thought I was good at and what I enjoyed, that sort of fit for me. Because I initially didn't want to do a residency. And I will say I've again had good mentors that sort of coached me along the way in terms of my leadership style. Coming into Mass General, and sort of assimilating to a different culture, right? You have to change your leadership style. I think that I've had the fortunate opportunity to have, what we call 360-degree, sort of assessments of my leadership style and things that I've worked with people to say, hey, you're really good here, but there's some other areas you need to really work on in it. And you have to be conscious and you have to work at that, because nobody's perfect, right? There's some people that rise up in certain situations and others that maybe are not so good in different areas. So I think, I always want that feedback, kind of going back to attitude and constructive criticism, even still at this point. And in my role, like, yeah, I didn't just make it, like I want to get better and I want to continue to evolve in terms of my leadership. So it has changed. I think I've had to learn to be a lot patient. I am like business, and I need to sort of slow down and be patient and talk to my, be able to talk to my team and not just be like, let's just talk about work all the time. Get to know people, get to know what drives them, what motivates them, what their family does, those types of things, and really sort of engage in the staff more than I probably was, because I was just sort of like, we got this project, let's get it done. And it's not just about getting things done. It's about investing in people and coaching people and mentoring them, addressing their needs as a department or as an area. And just like you guys want to be supported, developing people's careers and their professional development. Those are some of the main things that people, want to have. So I think I've evolved. I think I continue to work on things. I have good days that I'm on top of really the things I need to work on. And there's other days that maybe I'm, in the midst of stress and everything going on, you sort of revert back to kind of your traditional leadership style. So it's just being conscious of that. I even have sort of a note over here on my desk that every morning I'm kind of reminding myself, hey, just remember, you need to go out around on staff. You need to be doing those types of things, which is really important.
So throughout your career, I feel like it's important to not have the quote unquote, the yes man to tell you always, yeah, you're doing fine, you're doing perfect, whatever. Has there ever been a time where a friend or family, colleague, has critiqued you on something and you didn't like what you heard about it, like whatever they told you? How did you deal with that?
Yeah, I think there's been a lot of situations, from students to residents to jobs. And I think it kind of depends on who you're hearing it from, and obviously what they're telling you. I push my boss to be very blunt with me. Tell me what you think I'm doing good and tell me, where I can improve, right? It doesn't help anybody if you just are told you're doing great, keep doing what you're doing, right? That there's still opportunities to improve. And so I want to have those relationships, and I seek out people that will give me that feedback to say, hey, you need to improve upon this. Of course, and there's people of, authority or preceptor and rotation that says, hey, you really need to, get your show on the road. I think the toughest thing, I don't have a specific example, but I know many people have come into this where sort of somebody says something that's pretty tough to swallow, about your performance or whatever it may be. And you may say, I don't think I came across that way. That's not what I meant. But perceptions mean a lot. And whether or not you agree with how you were perceived in that situation or that moment, you have to realize that is what is being displayed. And so it gives you an opportunity to sort of take a step back and say, all right, do I need to be a little bit more careful with my words? What is my body language like? Was I a little bit too aggressive? Those types of things. So I think you can learn a lot, even if you disagree with people's perceptions of you. And so how do you get that feedback? As a student, as a resident, you're going to get that a lot, right? Because you're still sort of in formal training. But as you get out of your position and into a job, you're probably going to get evaluated once a year, right? And hopefully your evaluator is going to really invest in giving you both positive and constructive criticism. But that's not all that common. And so how are you getting that feedback from other people, I think will be important.
So what do you think is next for you in your career within the next 5, 10, 15, next year? what do you
guys
plan
like
on
ask? So here's the deal. I really don't know. I mean, I very much enjoy this position. When I came in, this was sort of a 10-year plan at least, but I got this role a lot earlier in my career. I probably, most likely should have been in this role another 10 years from now. Just based upon historically what other people, in terms of their experience coming in. I don't know. I mean, I want to continue to, I still see myself working here at Mass General and continuing to work with the team here to be strategic and innovate. And and take things to the next level, not only here at MGH, but in healthcare in general. I think there's more work than I ever would need in this role. It's not like I'm sort of saying, well, we did everything that we could and what's next. It's complicated. It's a very complicated organization, and I think there's more to do. I have some roles at the system level, which we call Partners Healthcare, that has, another academic medical center, Brigham and Women's, and a bunch of community hospitals. So there's some initiatives that we're doing at that level. So it's not for lack of work, but who knows what will bring. I never thought I would be here. I'm always open, but I'm very content in my job, and I think there's huge opportunities and still more that we need to do here at Mass General.
What is the toughest decision you've had to make career-wise?
Toughest decision? I don't think I've really had any tough decisions. I think for me, even taking this position, I had to move my family 1,000 miles, but it was at a good time, both professionally and personally. My kids were still young. They really weren't in school. I was coming kind of back home in a way. So that was pretty easy. I don't regret anything. I don't think there's been tough decisions in terms of my career per se. I mean, I've been basically at two places. I mean, I've been happy with the residency that I chose and the program that I went to. I was happy to stay at the organization that I was, and I'm happy to be here now. I think, like anything, you, again, have to continue to be well-rounded as opportunities come up, and you can say that I'm competitive for what those are and be able to make the right decisions because you sort of have the backing, the knowledge, the wisdom, the experience of the questions to ask and know where sort of the landmines and pitfalls are, I think is the important piece.
Cool.
So basically, if you could redo anything throughout your career, what would you do? It could be as a student, as a person, maybe in high school, maybe
redo. Wow, man. I would redo this podcast to know that all these tough questions were coming my way. No, like I said, I don't have any regrets. I think I've been very blessed to have the path that I have and have had the support of the team that I had. Maybe my only regret, it'd be nice to have moved into I loved where I lived in South Carolina in Charleston. Nice to maybe have been without kids in a bigger city and, done things a little differently. But I love my kids now and, it's a little bit different, but I don't really have any regrets. Again, I think I've been blessed and people have guided me, and I think I made sound decisions that sort of, allow me to say that.
Okay.
So we actually have a classmate that actually got accepted to your residency program. He's going to be coming up there. So what is your message?
Any good?
Pardon me?
Is he any good?
Very good.
Yeah.
Very good.
Oh, okay.
His name is Williams. So if he's watching.
Okay.
But what
Williams, we'll put him through the ringer.
Well, what message do you have for the incoming residents that you guys have coming in? Is there what would you like to tell them?
Yeah, I think this is not just our incoming residents. I think this is residents across the country. I think, here's an opportunity to step up, right? You're no longer a pharmacy student. Yes, you're still in a training program, but this is your opportunity. You're a pharmacist now, right? You are a licensed professional. And so you need to, going back to no drama, right? You need to work hard. You need to have a great attitude. You need to, residency is extremely tough. You need to be open to sort of where you have areas of opportunity, push yourself, push your preceptors to push you. That's only how you're going to get better, no matter how tough it is. The other thing that I would just say is, again, it's never going to be smooth sailing. It's going to be ups and downs. And so you got to expect that. You got to plan for that.
That's what makes it fun though, right?
Sure. But there's some people that takes a little bit longer time to get back up. And they just they get blindsided. So how are you really thinking ahead? How are you using the resources, your preceptors, your advisors to support you through your program? And just continue to have that light at the end of the tunnel. Again, building out that toolkit in residency, again, being well-rounded is important. So that's what I would say. And again, I think just professionalism, is really key in terms of when you're interacting with physicians and nurses and you're up on the floor and the teams, you're going to be looking for a job. And if people at your organization don't support you, that's not going to help you well. So how can you just kind of put your head down, have a good attitude, and work hard, I think, is really my advice.
So I want to end it with a fun question.
Uh-oh.
We asked this question to all of our guests. So if we were to go back to high school, undergrad, even pharmacy school, and we were to speak to your friends, best buddies, and colleagues, what would they say about you? If we're like, hey, who is Dr. Fortier? What would they say?
What would they say about me? I would say that I think they would say that I'm very driven. I have my hands in a lot of different things. Like I struggle to say no to stuff because there's so many cool things going on. I'm sort of all in that. I have high expectations. And I would say, that Chris is tough. He's firm but fair. He wants what's best for everybody, for the patients, for the staff, for his colleagues. He wants to elevate and elevate practice to the best that we can in terms of taking care of our patients. I think hopefully that's what people will say. I like to have a good time. I like reality TV.
Any specific shows?
I can't tell you what shows because you'll make.
Yeah, let's not get into that.
But yeah, I mean, I like to have fun too. Work hard, play hard. So that's me.
Perfect. Well, do you have any last messages for whoever's watching?
I don't know. I think I've gotten it all out.
Perfect. Well, we want to thank you so much for taking the time to sit down with us. I know you're very busy, so we really appreciate it.
Great, guys. I appreciate the opportunity.
And thank you for everyone that was tuned in. My name is Nima.
My name is Aaron.
And thank you for accepting our invite.